Welcome to The Bone, the podcast that goes deeper. Here we cut through the noise and get straight to the core of the issues that matter. From real stories to raw truths, we dive deep into the conversations that shape our world and challenge our thinking. We're not afraid to dig in and get to the marrow of it all. Whether it's life, culture, or business in sports medicine, we're here to break it down raw and real. No filters, no fluff, just to the bone. With your host, Shelby Daly, we're getting to the bone. This is a clinically pressed, approved CEU podcast. Find the quiz to gain credit at clinicallypressed.org/courses. Clinically Pressed Company, making the complicated simple through results that give back. Find out more at clinicallypressed.org. Let's get started.
Welcome back to the Bone. Today's guest is Dr. Nikki Harris. She's an athletic trainer and educator and a leader focused on career development and professional identity within the profession. Dr. Harris serves as an associate professor and director of recruitment for the athletic training program at AT Stills and has been actively involved with the NATA through innovative focus tax. Innovated on career advancement and professional growth. So welcome to the show, Nikki.
Yay, thanks for having me. Like I said, you're a rock star, so I feel very honored to be here.
No problem. Thank you so much. So today I want to talk to you about professional identity. I know that's been a hot topic on LinkedIn. A lot of debate going on how do we define ourselves? Where are we going with scope of practice? How do we better advocate? So for listeners who may not know why you got into this topic, can you give a little explanation and background of why you became so interested?
Yeah, that's a great question, right? So I always think, I saw a post actually on Instagram or something the other day that said we shouldn't connect ourselves to a certain company or a certain organization or a certain anything. However, we should really connect ourselves to like a greater purpose. So I feel like that sat with me over the last like couple weeks as I've been like kind of culminating and thinking about this. And I think it really stuck with me because everything that I do, like I was giving a talk too, like it wasn't on my bingo card to be in education. It was also not on my bingo card to be in leadership. Like I was never on leadership and coming through high school. Like I wasn't in clubs. I wasn't a leader. But I think for me, it just all stems back to like my values. I'm a problem solver. I'm very inquisitive. So I think I always want to know. If I see a problem, I want to know like, why is this happening? And like, what can we do to fix it? So I think for me, everything has really come down to me identifying my own professional identity and kind of being able to reflect on what were the challenges or what didn't I know at the time. And then really being able to help others like not have the same barriers, right? Although I feel like I got really lucky and had a great path, there's definitely some things that I didn't know at the time, especially like as an early career professional, as a person studying athletic training or wanting to become an athletic trainer, there's some things that I didn't know. And I think if I can have the opportunity to really help others with that earlier in their journey, then I feel like not only is it good for them, it's good for me, but it's good for our profession and healthcare as a whole and the patients that we serve. So formally, I got involved with this because I was the chair of the NATA Career Advancement Committee for 4 years, which stemmed from the Young Professionals Committee. So obviously, as a young professional, I was representing young professionals kind of with that same passion, and then eventually kind of trickled that over into career advancement, which has driven some of the more formal products that I do. But the passion really for just wanting to help people be their best selves, I guess you would say, is really what drives my work in general.
Awesome. I think right now we're at kind of a crossroads of where the profession's going to go.
Yeah.
I think we've had great leaders within the profession pushing for different advancements and all that. But now, with how healthcare is running right now and kind of a lack of access in the public sphere, I think we've done a great job in the athletic arena. But where do we go from here? We have so many skills that are great for athletics, but there's the public portion of it too that I think we can start helping out with. So I think if nobody's on LinkedIn and seen the debates, it's how do we really categorize ourselves and educate on all that we can do in a concise way where we don't scare people away or bore them to death with everything we can do.
Absolutely.
But when we talk about professional identity, what would you say your definition of what that entails.
Yeah. So speaking of debates, like I will debate that. And I hope to get into that with you today of, like I think that's where we get wrapped up sometimes, right? We get so focused on the nitty gritty and the minute details of like, it's athletic trainer, not trainer, or it's athletic training clinic versus athletic training room. And sometimes I think we miss the larger picture about
Hmm.
how we can really educate people, right? Because I think education, ultimately, anything that you've learned that's meaningful for you or has changed your way of thinking has been because of an experience, right? Not because somebody has told you to do it. Most likely it's because you've had some type of experience or thing that has transformed the way you think about that. And I think when we look at the public and how they look at athletic trainers, most of the people who advocate most for us are individuals who have experienced an athletic trainer, either as a patient, as a other healthcare provider, working interprofessionally, as a friend. Those are the people that really go hardest for athletic trainers, right? And I think sometimes we get bogged down on the details. So kind of going back to my earlier comment, like when I define professional identity, I think it is ultimately like the values, the experiences, the purpose, the passion, the expertise that drives you as a person and as a professional, right? And it's not just a role. So I think a lot of people define themselves as an athletic trainer or a professor of athletic training or a clinician or a football athletic trainer or a baseball person. And it really gets away from like the true identity, right? The identity is like, what type of problem are you trying to solve? What type of person are you trying to serve? What kind of values kind of guide your decision making as a clinician? Because titles are going to change. Like you will be an athletic trainer, but you won't always be a baseball athletic trainer. You won't always be an industrial athletic trainer. You won't always be a professor. Like hopefully, as you advance throughout your career, that title and that role and those responsibilities will change, but your overall identity as a professional shouldn't change, right? Like the overall way that you are trying to help people and the problems that you are trying to solve in reality, I feel like, not to say that we can't grow and evolve, I don't mean to say it that way, but that shouldn't change, right? Like ever since early in my career, I have wanted to serve like underserved populations, right? And I don't think I've worked in the high school setting, worked in the collegiate setting, I've worked now in higher education, and none of that has changed. Like my purpose has stayed the same. It's just been the types of responsibilities and roles that I have to make an impact on that, right? So am I doing it at the leadership level? Am I doing it at the NATA level? Am I doing it every day in the classroom? Am I doing it per diem? Like, but the mission really never changes, right? To get people back, ultimately to get people to be the best version of themselves, whether it's academically, whether it's clinically, et cetera. So I think so much of identity is like, who are you as a person? You as a person, and then you as a clinician, and like, how does that match, right? You're not just an athletic trainer. I think of like, it's National Athletic Training Month. I think of like the more than a trainer graphic from them. It's like, but you are like, in reality, you are more than an athletic trainer. And what drives you every day and where do you want to go with that? And that should ultimately be your professional identity.
Yeah. So with that statement, I know when I've been in the profession for a little bit over 10 years. So exciting to become a certified athletic trainer. Such a cool job. We're working with professional athletes, peak performing athletes, all
Mhm.
these different settings and everything. You get really wrapped up in that title of, well, or that definition of yourself of I'm an athletic trainer. And I don't know if I feel that's kind of in a lot of healthcare professions. I mean, you run into a doctor in public and somehow it comes out, oh yeah, I'm a doctor.
Right.
So how do we teach athletic trainers to become a regular person when they're not at the job, but be able to advocate at the same time for the profession without defining themselves of, oh yeah, she's an athletic trainer, if that makes any sense.
Yeah. I mean, and I don't always know that we have to separate it, but we have to know
Hmm.
that there's something else to that too, right? We have to know that maybe you are a clinician or a person that helps people and not just, again, like the athletic trainer. But I think or I don't want to say ideally, but essentially identity and belonging are really attached, right? So I know for me, like some people didn't know what they wanted to do when they grew up. Like I was a little later to athletic training, and I feel like a lot of people who are athletic trainers, like it clicked. When you found athletic training, it was the perfect place for you, right? It's the classic mix of like sports and medicine and schooling, where people found this place where I feel like they belong, right? And I think identity ultimately develops best when people feel like they belong somewhere. So if you hear kind of like the grouchy people on social media and LinkedIn about like they hate it and it's a terrible profession and yada, yada, yada. But in reality, I feel like when people have an employer or a place where they feel like they belong, where they're part of a team, then ultimately their identity, like that encompasses some of their professional identity, right? And I don't know that there's something wrong with that. I think just again, thinking about what is driving you ultimately. Your patients, obviously, I've had patients that have made a huge impact on me, right? And that changes me as a person and it makes me more connected. And I want to call them my kids or my patients or my athletes. And we get back into like terminology and what's appropriate. But that's ultimately because I think your identity is formed through the experiences that you have, right? And a lot of us, even though on the internet it might look otherwise, a lot of us have had positive, meaningful experiences as an athletic trainer. And that's why we do what we do so much. So I just think the biggest thing is to, and I tell work-life balance is like, that's not a real thing. To me, like it's just not a real thing. It should be healthy. You should be taking care of yourself, but it is very hard, particularly in athletic training, to separate yourselves from, or when you work in sports in general, to separate yourselves and just go home and like not be an athletic trainer. That's not realistic, right? So I think the biggest thing is, again, just figuring out what do you want to accomplish. I'm an athletic trainer that wants to be good at this or that wants to take care of this type of patient. Work-life balance, I think, comes from being able to separate yourselves from all the extra activities that we do that don't necessarily relate back to that goal, right? So we know in athletic training, there are a lot of other duties as assigned, some more than others, depending on the setting. But really being able, I think as you mature, and I know as I've matured as a professional, being able to say no, and not just no because like I've worked 40 hours this week, but no because what you're asking me to do doesn't serve the purpose that I'm trying to do, right? And I think we have to be able to put up those boundaries. First of all, we have to know what the purpose is. And I think a lot of people are lacking that. Like they know they like their job, but they can't articulate exactly what it is that they want to do, right? They can't articulate that value or what that long-term goal is. So I think first step is identifying that. And then the second thing is just kind of building your life, both personally and professionally, around things that support that overall goal that you have, if that makes sense.
Yeah. Well, and I think, our educators are great. They're doing a lot of things. They're trying to shove a lot into the bag in 2 years. I think one thing I see that's missing within the beginning of the program is really reflecting with the student of where do your passions lie? Like, why did you get into athletic training? I think previously a lot of people were title chasing a bit of, oh, I want to work professional sports. I think that's a big recruitment tactic. That's exciting. You are associated with something bigger than, NFL. That's godly in some places. So I don't know if we're having those reflective conversations of why do you want to be in professional sports? Is it the risk that's involved? Is it the elite athlete? Is it the treatment? Is it, there's so many different things.
That part, because every time I meet a student now, particularly like a professional master's level student, and then they get like the coveted PFATS internship, right? And they're like, I'm going to the Jags or I'm going whatever. I'm like, okay, great. But like, why? Like, why do you want to do this? And I will say out of 10 students that I asked, there may be 2 that can articulate why they want the experience, other than just saying like, oh, I want to be a professional football athlete trainer. But like, to your point, why? Do you want to deal with a high caliber athlete? Do you, are you interested in injuries that happen more likely in football? Do you, like, what is it? Why? And I feel like people have, and I don't expect that, again, like at the student level, they're very immature in their like educational and their professional journey. So I think it would be difficult to expect them to like articulate that. But I think there are professionals that I know that are in that 7 to 12 year career advancing phase and still can't articulate that. And again, I think we make decisions maybe poorly when we're not able to articulate that, right? We're thinking that it's moving, or we're thinking we want to go to professional sports because, like you said, that's the coveted. Everybody says, why don't you want to work in professional sports? That's, the pinnacle of athletic training, which it could be if that's what you want to do, right? If that's your purpose, or if that's what you want to be good at, or that's the population that you just are dying to serve, then that may be the pinnacle. But it's not the pinnacle just because it's the most publicized, if you will, or most visible aspect of athletic training. So I think for students, I agree to your point of like educators need to encourage that reflection. I know like when we were in school, we always did like at the end of a semester, you would do like your clinical reflection paper about what happened at your site and if you liked it or if you didn't. But I don't know that they ever forced us to really dig deeper into like, okay, what specifically did you like? Why didn't you like it? Why didn't you learn, etc. Right? It's just kind of like this space for you to vent, if you will, without kind of pushing it deeper a little bit further than that. So I agree. We can, from an education standpoint, I do think there needs to be a little bit of a stronger push of just, what is it that you're trying to accomplish here? Now that you've seen all it, because, when you're in school, you just want to see different things. And then you like some of them more than others. But really reflecting to the root of why did you like it? Why does this inspire you? Why does this want you to persist in athletic training, particularly as people are dropping out of the profession for that reason, right? Beyond the burnout, when you're working 80 hours a week in the NFL, like what is it that's still going to drive you when that excitement perhaps is gone and you're giving up, life or personal milestones? Like what is it that's going to drive you to continue to want to work in that setting? And I think you can lose that. We see that in the collegiate setting. Like people, again, are switching settings and drones because without that greater idea of what you're trying to accomplish in that position, it's real easy to get burnt out. Real easy.
Well, and I think even just the part of why do you want to work that setting or sport, we don't even reflect on the personal life. I mean, work-life balance, we said, is way different for every single person. But do you plan to have a family? Like, how will the logistics work after experiencing this rotation of, NFL? We keep bringing up, you're there, 12 to 14 hours a day. How do you expect to balance a relationship with somebody else, a significant other, or kids? Or, we don't bring in those different factors of how do you balance that all out. And I mean, we're not psychologists, we're not counselors, but I think it's just bringing to light of what is important in your life outside of this profession. And how do you keep those both moving forward and not get stuck?
Yeah, I think historically, I guess I'll say as a profession, we haven't been transparent about that, if you will. And I think when we do it in a very negative light, right? Like, oh, you'll never have a family, or you can never be a female that works in professional sports. Like, where it's discouraging, which in reality, like you said, you are working 14 hours a day, sometimes more. You are away. There are a lot of logistics that go into having, for example, one of those high power positions. And it doesn't mean that you can't do it. But I think, again, having the piece that's motivating you through that, but then also just being transparent about it. Like, let's plan for this, right? Like as an educator, I think, okay, for example, I have a female who may want to get married and have kids, but also have aspirations of working in the NFL, right? So I think as an educator or a mentor, it's my job to think through what that might look like, right? I'm not going to tell you that you can't do it because you absolutely can do it. And I think people are doing it now more than ever. So it's possible, but there's a responsibility on the behalf of the educator or the mentor to talk about what that might look like, right? Like, how do I put myself in the best position? How do I manage my personal life? What questions do I ask an employer about how they value family or what things look like, right? So I don't think it's our job to tell somebody they can or cannot do something. It's just our job to make sure that they are clear on what they want and that we're assisting them in kind of weighing their options and creating the best scenario for them. Because I think when you're going in blind, that's when burnout happens. That's when discouragement happens. That's when people question, like, is this for me, right? Because we talk more about like professional identity and they may say like, that's not for me because, I have kids or I have a family or whatever it may be. They may feel like they don't belong there, when in reality, I don't think that's the case. We just need to be more transparent about what comes with certain positions or whatnot, and then trying to really plan for that realistically on the front end rather than trying to kind of clean things up on the back end.
Yeah. So when I came out of my master's program, it seemed that many athletic trainers were very ingrained in their team or department, almost a codependency on thinking that they made it or broke the success of the team if they weren't there or if they were there. I feel the pendulum has swung a bit for new grads that are really trying to set up barriers, but their accessibility is so new. I haven't wrapped my head around it, where it seems almost inaccessible to them providing work or adequate coverage. I know this pendulum kind of equals out. You need one extreme and another extreme to get kind of in the middle. I guess I'm still wrapping my head around on the professional identity portion of there is a balance of how much accessibility you need to have as a healthcare provider, and how athletic training is set up. But at the same time, setting such hard boundaries, it's very rigid. We know athletics never goes between the hours that it's supposed to finish. Emergencies happen. I guess what can we take from that scenario of how to set up boundaries but still operate effectively within the athletics atmosphere?
Yeah, I mean, I think I see that too as a old millennial. I'm on the end of millennials. I just aged out of the young professional. So I guess I'm like a lemon pepper seasoned athletic trainer, as I'd like to say. But I definitely see that, right? So to your point, there were a lot of things, I think, in regards to not just availability and accessibility, but there were a lot of things that were pretty standard, I think, when we went through our programs, right? Versus now we've swung, like post-COVID, I will say that people have really put up these like black and white boundaries. And to sometimes I say like I'm thankful for the youth because we now have freedoms that we probably wouldn't have had if the younger generation didn't come in and set these really strong boundaries, right? Like I can now do things at work because other people have set these boundaries. So I'm thankful for them. But to your point, I think this is a relationships profession. Like at the end of the day, every person that's in athletic training is in here because of the relationships you make with your patients, the relationships you make with your coaches or your administrators. Like we are a people profession at the end of the day. And so like I said, sometimes we overdo it, but I don't think anything is wrong with that. But I think when it comes to boundaries specifically, it's like bang for your buck or value, right? So I think anytime you set or you draw this hard line of like, I'm only going to do 40 hours or I'm only going to be available between, I have a hard stop at 5 p.m. Like that is not how this works. It's not how the patients that we treat work, right? And I think when we really, again, kind of lead with that purpose of like, okay, I can flex this boundary if X, Y, and Z happens, right? Like I'm not just coming in here because you decided to throw a last minute practice on here. However, I will stay late if I'm recognizing that we have an excessive amount of injuries this week or X, Y, and Z needs to be done. So I think it's just really, for me, it's making sure that the time that you are using is valuable. The culture of athletic training has historically just wanted us to always be around, even if we're not doing anything, because they just want to kind of, particularly in athletics, right? They just want to know that the athletic trainer is there. And there are lots of times that we are there and we're not necessarily being productive, right? We may just be sitting on the sideline at practice, not actively providing care, just waiting for something to happen, right? Or we may be in the office killing time in the athletic training room because there's a 2-hour window between treatments and practice or whatnot. So some of the time that we have in these excessively long hours is wasted time. So for me, it's just like deciding what is the value of that flex. I don't want to be so black and white that I'm telling you I'm not going to do this ever because I deserve personal time versus I will do this if it's an active thing, right? Like I will come in and do Saturday treatments if half our team is injured and I know that I'm going to have patients there, but I'm not just going to offer it and nobody's there. So I think it's really being able to communicate, right, with your employer, being able to communicate with the people that you work with every day and really deciding like I'm willing to do an extra 5 hours, no problem, as long as that time is being valuable, but I'm not just going to do it to sit here. I'm not just going to miss my friend's wedding because we have a JV softball game. Like I'm not going to do that. You can hire somebody on Go4 and that's what we're going to do because I do care about, or I'll help you hire somebody on a Go4, right? Because I do care about my patients and my athletes, but I'm not going to give up the things that I love. So I feel like work-life balance is always about finding the happy medium, if you will, between what is valuable in terms of what's important to you as a person, but also what's important to you in terms of creating that professional goal, right? So if I'm going to be the best healthcare provider I'm going to be, I'll come in and do something related to healthcare, but I'm not coming in there to twiddle my thumbs and do water bottles, because that's not a valuable use of my time. And I think that's what it comes down to, right? Is being able to determine, like, when can I add value versus when are you just asking something of me, just to ask something of me. And I think that all comes down to communication. The one thing, not to generalize generations, but I will say we don't like to talk about things. There are a lot of, maybe it's post-COVID, even with people that are not of that generation, but we tend to like shy away from like in-person or like real life conversations with people. And sometimes difficult conversations need to be had, right? Because even coaches or ADs or whatnot may understand if you're having an active conversation about like what is happening. Like, I feel like I'm here wasting my time, and that's what makes me angry. Everybody's going to be angry if they give up something in their personal life to come in and waste time, right? So like, are you documenting what is done? Like, what are you doing to show that this is good or this is bad, versus just setting this hard boundary of like, I'm not going to do it. I think it's admirable that they advocate for themselves, but it's also a great way to burn bridges, right? Because people feel like you don't care about the program, or you don't care about them, or you don't care about your job if you're just so black and white to say, I'm not going to do this. Especially, again, if you're going home to do nothing, you're just saying, I'm going home at 5 every day so that I can sit on my couch. Like, that's fine. But again, maybe they'd be willing to give you that time if you're doing something valuable on the other end too. So all in moderation, as my mom would say.
And I think it's another pendulum swing is, when we were probably going to school, there was still that very traditional athletic trainer that was so excited just to keep the team going. And then there were other responsibilities that were added, like laundry, travel, booking food, hotel, whatever it may be. And those have kind of stuck just for an efficiency factor, and that we were trying to push for full-time employment or getting more athletic trainers at certain departments. We were kind of just, let's just do it all so that we can show our value. Since then, now with how our scope of practice has increased, now we have so much on our plate. I don't think there are many athletic trainers that are still doing those various tasks as assigned. I think we've done a great job trying to cut those off, but now we're in this pendulum swing of, wow, we're doing so much in the performance healthcare portion of the athlete. Coming back to center, is it just because we have too much on our plate most of the time that it's hard for people to articulate their value or professional identity? Or I guess, why is it so difficult for us to encompass all that we do in a nice, concise manner? I feel that we provide a continuum of health of, pre-injury, during injury, and post-injury back to full function and performance again. But it feels like everybody's just kind of grasping for different things when they're trying to explain what they do as an athletic trainer. What is your impression of that?
Yeah, historically a problem that we have had for quite some time. So I don't disagree. I think I was having this conversation ironically recently as well, is that there's kind of two sides to the story. And I think about this because like professional identity is like who you are as a person, as a professional. And I think branding or like personal branding is what that looks like on the outside. And I think historically, athletic trainers are so humble. I just love us. We're so humble. We just always want to be in the shadows. And like, that's okay. But I think for a long time, we have kind of taken the viewpoint that our work will speak for itself, right? Like, oh, we don't have to talk about it. We don't have to do this. Our work will speak for ourselves, right? If everybody's healthy and playing, then that means I'm a great athletic trainer because I kept everybody healthy and playing. And I think we've gotten perhaps overlooked or passed over or whatnot, if you want to say, because we have done a really bad job justifying what it is that we do, right? One, because we can't even articulate it. So that's probably problem number one, right? But two, it's just, I think we've always assumed that people just are grateful for what we're due, right? But then we're also in the same boat. Everybody's mad because we're never appreciated, right? But in reality, I think particularly in the times that we're in, that we have to capitalize on some of that, right? And I think, again, I love the fact that we are so humble as a profession and that we don't want to be in the spotlight. But in reality, other people have come into the spotlight, and that's worked really well for them, right? Like we all complain about strength coaches get paid a ton of money, and like, why do they get paid a lot of money? And they're not even healthcare providers in reality, but they capitalize, right? Like they knew that they had a very specific purpose within the team or contributing to overall team success. And they capitalized on that. And over the last like decade, it's worked out really well for them. And I think we are to some extent like too afraid to do that as a like culture within the profession, right? We just want to be this like unknown thing. In reality, like we have to show that we're valuable, right? And we do lots of things. The problem is not that we don't do the work to be valuable, but we do a really bad job of showing it. Unless something like catastrophic happens, then obviously, you know, we put a story out about it and people say, oh, that's great. But I think on a day-to-day basis, if everything is healthy and moving smoothly, we just say like, oh, we're doing our job and everything's great and we're valuable. But like, that's easy to get overlooked. And then it just looks bad when everything isn't going great. It's like, what did the athletic trainer do? They're no good. They don't know what they're doing. I need a new, right? Because things have not gone wrong. But when we just let go, things go smoothly and we don't draw attention to that, then I think sometimes we kind of miss the boat on pushing ourselves forward as a profession. So I think just generally we need to make light of those things. I know a lot of it goes back to documentation and cost savings. And those are, I think, a piece of the puzzle for sure. However, like I love, even for example, like all of the athletic trainers that have social media, right, that are doing these great things on social media to kind of get the word about athletic training. Generally speaking, I think like we have to do that, because if people don't know what we do or what impact it makes, like on a tangible thing, then we can never move forward as a profession. I think as individuals and a profession. Like there are so many things that in athletic training, there's so much flexibility in terms of there's so many settings you can work in. There's so many levels that you can work at. But sometimes in career advancement, you have to create your own position, right? Like if you know you're doing laundry, okay, terrible example, right? But maybe you've been doing laundry for the last couple of years, right? Like, are you writing that down anywhere, or does the laundry just get done and people are just grateful that they have clean uniforms, right? And I don't know that you want to be the director of laundry. However, somebody has to do it. And I think if we don't draw attention to those other duties as assigned, in addition to the healthcare role, and then we don't find opportunities to capitalize on how we keep systems running efficiently because we do everything, then that career advancement is always going to be limited. That salary is always going to be limited because people pay for service, right? So I just feel like we can't sit in the space where we're always just saying like, if all's copacetic, then I'm doing my job and it's great. Like, we got to document. Like when patients are happy, we got to document that. When people know what we are, when parents are happy, when the team is running smoothly, like we have to be able to capitalize on that. I hate to say document because document obviously is important, but there are many ways to bring attention to how we keep systems running efficiently. And I think that's a whole cultural shift. It can happen in individual places, but in reality, it's an entire cultural shift. I feel like that needs to happen in this profession. And I hope that some of these newer athletic trainers that come out that are willing to set boundaries are also good at that and kind of pushing some of the elders, for lack of a better word, in our profession to that new cultural shift of it's okay to talk about what we do and how great we are at it.
Well, and I think you brought up a good point of being humble. You know, if everybody's healthy, we're doing our job, but we aren't providing data points on those positive points. I think that's why strength and conditioning has outworked us in the professional manner, is that all their stuff is usually positive. Oh my God, that guy added 5 more pounds to his PR. Like, you know, it's an incremental increase up the stairs, where we still get to deal with somebody got injured, which is never good. It's not that positive news. So how do we, you know, capture the good of, you know, comparing last year's roster to this year's roster? Look, we have less injuries than we did last year.
Mm-hmm.
Those prevention programs that we are implementing with the strength and conditioning, you know, I think those are correlated. I mean, there's better ways to do the data on that, but I don't think we're providing good enough data points that are positive to show all the underlying work that we're doing of, you know, last year when there was that spike in temperature and we had a bunch of heat illness. This year we were way more prepared and we had none. So, some of those risk mitigation things that we are very good at, we need to bring more light to of how we're preventing things. Everybody's always like, well, did you really prevent it? Or how do you actually show that you really prevented it at the end of the day, which is very difficult. But I think if you can at least compare, I don't think that our coaches have taken a lot of research and data courses. So it's really how you spin it to them and how you present it. So I think those are some of the things that we aren't advocating for ourselves within our employer of everything's always kind of negative of, oh yeah, we had 7 ACLs this season. What are we going to do about it? Rather than, hey, everybody, the whole women's soccer team made it through with no ACLs this season. So you have to catch those highlight points and really drive them home at the mid-season, end-of-season meetings. It doesn't have to be dire news every time. And I think we get that black cloud sometimes.
Yeah. I mean, I think in reality, like, again, I feel like we have to be real with ourselves. Again, I love that we're humble, but in reality, like, people pay for outcomes, right?
Mhm.
Like that is, they pay for experiences and they pay for outcomes. And at the end of the day, like, we have outcomes. And like, if nobody's getting hurt, that in itself is an outcome in itself, right? So like, I think the only way we push ourselves, particularly when we talk about salary and compensation and like career advancement, is if we can demonstrate that we're outcomes. Like, think about the patients that we serve. Yes, obviously in sports, outcomes are everything, right? But even like in the industrial setting, like, it's, these people are working and we're working for an organization who ultimately wants outcomes, whether it's the amount of product that they're producing, whether it's how fast they're producing, like, it is outcomes. Outcomes is what drives salary and compensation, right? So if we don't start to show what we're doing and the outcomes of what we're doing and get comfortable doing that, because I think there's an uncomfort there as a profession. Culturally, we are uncomfortable spotlighting those outcomes. And I don't know where that came from. Like, I really wish that I could go back through the history of the profession and figure out why we got so scared to like talk about ourselves and outcomes. But like, to me, that is the only way that we make progress in that. And just to understand, like, yes, we diversify it across all settings, but regardless of what setting you choose, it's all about outcomes. If you're in physician practice, in reality, your patients need to get better and you need to see a lot of them. That's just the reality of that setting. Right? So like, how are we proving that we are doing that? If we're industrial, if performing arts, anything, like, the dancers need to dance well and they need to do it every night for a show. So I think the more comfortable we can get with understanding that, the more progress we'll make. And I know there's a lot of debate with that, like in collegiate sports and like NIL. And I know we're always like, God forbid we get a bonus for making sure all the patients are healthy. I'm like, but why? To me, like, I have this argument all the time. Like, I don't see, and everybody's like, well, it's unethical. I said, it's kind of like when you're a teacher and you have different students, like one student that may be quote unquote more difficult to teach or have less experience versus one that has a lot of experience, and you're trying to teach to the middle. Like, I hate when we say that, because I'm like, okay, well, we have like ethical guidelines. So like, we shouldn't be thinking about only the people who are willing to break those ethical guidelines. Like, they are probably willing to break the ethical guidelines for a lot of reasons, not just that, right? So like, sometimes I feel like we miss opportunities for innovation because we are so worried about catering to like a certain population of our profession, when in reality, like I said, that's just the world that we live in. Like, outcomes are what drive advancement, what drive priority when we're getting funding for different programs and whatnot. It's because you produce outcomes. And I think, not to go on a tangent, but I think people are uncomfortable with that as a profession. And then I also think they just don't know how. To your point,
Mhm.
like, sometimes people think it has to be like all statistics, right? And all numbers, when in reality, it may just start with like a patient testimonial, right? It may just be one of your athletes doing a social media post about how great you are during athletic training month. Like, it doesn't always have to be this rigorous, like, scientific process. It just needs to get done, and we can perfect how we do it as we mature, like, in the profession. But I think it just has to be done, and we're uncomfortable and don't know how to do that. So I think in some of my work, I've really tried to break that process down and show people like everyday examples of like, what does it look like to collect data on something or to publicize something, so that people can understand that it's maybe not as hard as they're making it out to be.
Yeah. Well, and I think whenever we bring up that ethical friction for, getting a bonus or whatever, I think where my worry always gets to is, well, are we pushing the athlete too fast, too soon to get them back? And I mean, I think that's one of the weaknesses sometimes from our program is how, if you have outcomes, the certain checkpoints that they should be meeting before you fully return them. I think that's still somewhat weak in some areas of athletic training, but I think that's where my mind always goes to because it's like, well, it always is associated with the performance of are they out in the field? Are they winning? Are they performing well? Where there's other ways to measure those outcomes, and possibly getting the bonuses. I've never really been in a department that has KPI. What are we trying to achieve? What are we doing in the 3, 6, 12 months to better our program, provide more or different services to the athletes? How are we supporting coaches? Are we doing any leadership? Those types of things. And I don't think many athletic training departments have time or understand what a KPI in healthcare actually is.
Yeah, to me, obviously the sports and athletics realm is entirely different, but it's not uncommon in other healthcare professions to have KPIs or have metrics regarding like performance. I don't think that alone is a problem, right? But obviously there's a lot of ethics and conflict of interest and things that come in, particularly when we're talking about high level sports or things of that nature. However, to my point, I think, and also to your point, like there needs to be evidence-based guidelines, right? And we lack
Mm-hmm.
that in regards to some things, but this shouldn't be like you just make a game time decision, right? Like I know you're not ready and I'm shoving you out there because it's the national championship and I get a $5,000 bonus. Like that is absolutely wrong. However, if I'm guiding you through the injury process and you're meeting milestones and I'm documenting those milestones along the way and they look like they should look and nothing looks bad, then what is wrong with that, right? Because in reality you are contributing to the outcomes and the performance of the patients that you serve, right? So I think it's definitely a complicated issue, but I think the more that we can get comfortable with documenting our outcomes and the effects that we have on patients socially as well as from a physical well-being standpoint, the better we will start to create that narrative and people will start to understand the effect that we have when we are present as part of a healthcare team. So it takes, it's one of those things that will take probably many decades to really change the culture, if you will. But I think it all comes back to understanding that and then teaching people how to do that. Because like I said, I think there is some people just don't know where to get started, right? And a lot of us we're not used to talking about ourselves just as part of our own personal or professional identity. So I think there's some education that needs to happen there, because we often assume that people know how to do that. And in fact, I think they don't know where to start. So I think my role as an educator, or as a leader, researcher, whatever you classify me as, is, like I said, to help with that education piece and to show people examples of this is a way that we've done this successfully, right? This is a way that maybe you create a director of sports medicine position, or maybe you create a director of risk management position, or whatever that looks like. But these are some of the things that you may already be doing. These are ways that you can document the success of your department or of your team. And these are some maybe opportunities that you might have for career advancement because you now have this special set of skills or this kind of history or track record of achieving outcomes. Because I think, again, anytime you can show that you achieve outcomes, you're going to get a job, you're going to get a promotion, because essentially that's what employers are hiring for.
Yeah. So there's kind of the stigma that athletic trainers are support staff. In the traditional setting, I feel that we're sometimes the outcast. We're in our own department, but then we're kind of spinning all the plates, holding everybody up. When we break out of the traditional setting, even in other clinics, our skill sets are usually, the physical therapist assistant, kind of these assistant positions when we're working with other healthcare providers. How do we break this stigma as support staff?
I'll throw that back to you as a question of, do we want to be support staff? Because I'm not always convinced that we don't want to be support staff. So the question is like, what do we want to be known as, right? Because I hear that debate a lot of like, oh, we're support staff, but also to our earlier conversation, like we don't want to be in the front. Most of us don't want to be front and center. We want to be on the sidelines, which is essentially off the field or support staff. Identity as a profession, like we need to decide what we want to be, because I feel like we try to beat other people mad, right? Like we asked to some extent, I won't ask, right? But we sit in these support staff roles. And then when somebody calls us support staff, we freak out and we're like, what do you mean? And we beat the other people mad. But in reality, it kind of seems like we want to be a support staff. And that's okay. Like everybody has a role. And I think if we as a profession want to be a support staff, I don't necessarily think anything's wrong with that. I just think we need to be the best damn support staff there is, right? And we need to be valued because support staff is needed, regardless of, again, what setting you're in. Support, like the show cannot go on without support staff. So I don't think being support staff in itself is a terrible thing. However, I think we need to be clear where we want to be as a profession.
Yeah, I mean,
I don't know that we don't want to be support staff from all the chattering that I hear on the internet and in conversations. I think we kind of like being support staff. We don't like that we don't get the respect. It's like we want the on-field respect, but we want the off-field job, right?
yeah.
Which
Well, I
is
think
fine,
there's
but we gotta know we gotta understand what we're asking for. If that
Well, I
makes
think because there's so many restrictions on what we can talk about with HIPAA and all that, and patient privacy. I think that's part of why we're so humble is we can't really talk about it. I think in the traditional setting, I haven't figured out the best structure of where we should actually fit within the team. Should we really be in the athletic department reporting to the athletic director? Or should we be on the part of campus of, working with the healthcare team and we are supporting the athletics population, working with the nurses, the physicians, the on-campus health clinic, whatever you want to call it. I feel that that's where we're so torn is, are we performance or are we healthcare? And where do we want our tracks to align with? Since we dabble in everything, how do we fit in? Or do we just become our own full department by ourselves? We associate with the athletics, we consult with the healthcare clinic. Are we technically in a triangle, not just in one or the other? So I think that's where the support staff, I've never liked that we fully report to the athletic director. They have no medical training, they have different motives than what we do. I think that's where it gets difficult when we are trying to advocate or provide our professional identity, because the AD just wants athletics to run, people to be healthy. We need to keep it going. Sometimes outcomes are dependent on different aspects of the business model. So I think that's where it gets a little difficult, even at the professional level.
Mm-hmm.
There's directors that are strength and conditioning coaches, all these other specialties, which to me, it just is difficult for medical to be under somebody that does not have real medical training. But it depends what you want out of that director. Is it leadership, trying to get everybody to work together, or an understanding that somebody's going to back you up because they have the medical knowledge and can articulate it to the other stakeholders within the organization? So I think support staff is a loaded word at the end of the day. I can understand it. We are supporting the patient athlete, making sure they're getting to where they want to be. But then at the same time, with the history of athletic training, it seems that we are support staff to the coach.
Mm-hmm.
And I think that's where it gets difficult, because the coach used to make a lot of calls and medical decisions, and we didn't necessarily have the strength. I think we have the strength nowadays to counter it, and there's a lot more liability on the line. But I think it's just kind of that muddled history of, well, what does support staff mean? Because the elders probably had bad instances where their healthcare advice got squashed by a coach or somebody else, and it wasn't really respected at the end of the day.
Yeah, it's muddy water, so I don't mean to at all make it sound like it's straightforward.
No.
It goes back to like the identity thing, right? So I think you brought up a lot of things that make me think here, right? So one of it is just like, let me say this first. I absolutely think that our oversight in terms of who we report to should be to a healthcare professional. And I know that is more challenging in some settings than others because of the logistics. However, I do think the one who is ultimately evaluating our performance should be somebody that is a healthcare provider, right? Or has that healthcare administration background, if you will. So that I will say, I will preface with that. But I think it's challenging, right? Because to your point, it's a relationships profession. And I think particularly when we think about traditional settings that are like in athletics, like we don't want to be one of them. I hate to say it, right? Because we all know that our athletes come and talk to us about everything and that the athletic training room is a safe space. And like, I think that I know that I love that, like everything about practicing clinically. I love being that person and being able to connect with the athletes, right? Or connect with the patients about things that they may not feel comfortable or they may need mentorship, right? You have this all encompassing kind of role. And I think if we separate ourselves from athletics, if you will, and kind of go over to student health services, then we lose that aspect of team and community and family and mentorship. And that's, I think, a really important piece of like our professional identity, right? Like a lot of the reason we do what we do is because we get to impact patients regardless of age on like this one-on-one thing, right? And if we separate ourselves and go to your point of the pendulum, if we go too far to like the medical model, then I think we lose that, right? I hear about all the athletic trainers that don't like, that's my sport, those are my athletes, right? And we get really defensive of like, oh, so any athletic trainer can see any athlete. Like we don't like that, right? Because there is this sense of like almost ownership. I hate to say it because we have these like special relationships with the patients that we treat. And that's different than any other healthcare profession, right? Because they're just not interacting informally, I guess you would say, or like one-on-one with those patients if you're in a different profession. So I feel like it's difficult because we want to be support staff, because if we're not and we become looked at as the doctor or the coach, then I feel like it takes away that comfort element, right? Like we become one of them. So I feel like in that aspect, we want to be support staff, right? Again, for this umbrella term. But then on the other end, we like swing to the other end of the pendulum, right? And if we want the respect and kind of to be treated like this healthcare professional, right, that is above athletics and above ADs and coaches, then we swing to like the other end of the pendulum. So I think kind of to our point of the whole conversation is like, how do we meet in the middle? Like, how do we get the respect? Because I really think it ultimately comes down to respect. Like the nasty part that comes up when we talk about support staff is because of the lack of respect. Because traditionally in any athletic culture, you know, the support staff is the one that gets the short end of the stick and they're the one that gets yelled at and the one that doesn't get paid good. So we're trying to pull ourselves away from that without pulling away kind of some of the advantages of being the support staff. And, you know, I don't have a good answer as to how we meet in the middle, but I do think we need to figure out what that space is as a profession, as a culture, even as an individual, and then figure out how we kind of, like you said, capitalize on that monkey in the middle. But it's hard, to your point about everything. There's one pendulum where we go all the way to the medical model and we kind of lose what some people love most about being an athletic trainer. And then there's swinging to the other way where we're GAs for $18,000 and sleeping on floors. So we gotta find our way in the middle somehow.
Yeah. So with professional identity, how does that impact compensation, respect, like we just talked about, within the healthcare teams and with career mobility, since it feels like we are expanding super quickly, super fast? How do we use the professional identity to advocate for those different variables?
Yeah, I mean, I think your identity, like I keep saying, is not just what you do, it's who you are. Like, and we have to be very clear. Like, it's not just the fact that you're an athletic trainer. It is that you are, you know, a person who cares for people with orthopedic injuries, particularly people from underserved backgrounds, and you're really good at ACL rehab. Like, that's your identity. And I think I feel like they change terminology so much, but even like with the Katie, when we talk about contemporary expertise, like who are you? What are you good at? And what makes you valuable? And like, we need to learn how to stand on that, right? Like to create your own lane based on what you're good at. Like, so I feel like I'm good at running my mouth. I hate to say it like that, but like I generally say what I'm thinking, and I might not need to say it, but I'm never wrong. Right. And I think people know that about me now. And when certain things come up, I serve value, whether it be on a committee or on a leadership council or, teaching a certain class, whatever it may be. Like I have carved a certain lane for myself in regards to certain things. And that expertise opens additional opportunities for me, whether it be leadership, whether it be career advancement. And I think again, getting very clear on what that identity is and then putting value on that identity. People pay for a certain service or for a certain outcome. And the more that you can create a really clear picture of what somebody is getting if they hire you or they give you an opportunity, and the more you can be consistent about providing that service and or that outcome, that's how you build a lane for yourself in career advancement. I stick with that. This is a time where you can do so many things. You can be an entrepreneur, you can start a whole new practice setting, you can start, there's so much opportunity for athletic trainers right now. And I think sometimes we think the only opportunities we have are what's on the NATA Career Center or on Indeed. And I get that it's scary, and especially in athletic training, like entrepreneurship and things like that are new spaces for us as compared to some other healthcare providers. But I think the more that you can be very clear about who you are and then what people can expect of you, the more you can capitalize on that from a salary and compensation standpoint, as well as a promotion standpoint. So to me, that is how you advance your career at athletic training. There are many ways to obviously get good at skills and move up the career ladder, but ultimately it's because people are confident that you are going to provide a certain set of skills, whether it's patient care, whether it's leadership, whether it's conflict management, whatever it is. And that ultimately is why you get hired over somebody else or why you get a promotion over somebody else. And then, of course, when we can put monetary value to that comes salary. But I think as a whole, the more individual people that we can get to understand that and create these kind of pockets of expertise for themselves, I think the more we all move together to push ourselves forward as a whole. But that's my biggest. Who are you and what do you offer?
So with that individual advocacy, with your individual professional identity, how do I word this? Where has this somewhat victimization of the profession come from, where we think that the NATA should be advocating for our individual identity, professional identity? I mean, I've always had it within myself of I'm going to fight for myself. I care about all the athletic trainers, but if I can get ahead, that opens doors for other people. But I feel that it's become reversal of, no, everybody else has to open doors for me to make the next step. And where did we lose ownership of advancing professionally for ourselves, do you feel?
Loaded question.
I know.
I wish I had a clear answer. I think, and I've said this, that we are scared to some extent. I think particularly and I'm a huge advocate of going from the bachelor's to I'm a professional master's athletic trainer, so I don't know any different. So I'm really tired of people saying that we need to go back to the bachelor's. Like that's every time I see it, I'm like, what are we doing? Like, we're not doing that. What are we talking about? But I think we did advance very quickly, to your point, right? So there was the big jump, to the master's degree level. There was these DATs that came out. There was adding all of these skills in the 2020 standards for Katie. I know there's things in there that I didn't learn when I graduated in 2012. So I think there's evidence-based practice. There's, the CPC through the BOC. So we are, I think, advancing as a professional, as a profession. And with that, we are expecting more of career advancing or older athletic trainers, right? And I think there is almost a fear of being left behind, if you will. And there's this, I don't know how to do it, right? I legitimately, coming from the best place of me, think that people are scared because they don't know how. And I think a lot of times we assume because it's what do you mean? And we're oh, I want the NATA to get me more money at my job. It's because they do not know how to do it on their own, right? Like it's a complicated process. Like trying to negotiate salary is not a comfortable thing, and it takes skills. Like it takes intentional skill to become good at that, to understand where to get the information from, to understand how to form the argument, to understand HR structures. And I think a lot of that bad narrative that we hear is coming from individuals who deep down it comes to like this fear of being left behind and this like lack of knowledge of how to do it on their own. I feel like kind of like you, like me, we are individuals who have intentionally sought out advanced education, who have intentionally sought out these kind of mentorships and relationships with people where, you know, I'm just officially meeting you today, but I feel pretty confident that if you were in a scenario like that, that you would advocate for yourself and or find the resources that you needed in order to advocate for yourself. And I think that sometimes other people, I don't want to say fortunate because I'm pretty sure you got it out of the mud, just like we put in the work. But I feel like some people, again, don't know where to start or they don't have those skills. And those are the ones that we see complaining the most of like, I want NATA to do it for me. Very rarely do I see individuals that I know that have the skills being the ones that are saying, I want NATA to do it for me. It's generally the crowd of people who don't have those skills and are looking for somebody else to do it. So I feel like how do we get them those skills? I mean, that's the complicated part. But I think that's kind of the thing. Like it's impossible that NATA can advocate for all of these different people in all of these different places. Like that's just, yes, could they do a lot of things better as a representative of the NATA? Yes, we are continuously trying to do things better, but there are some things that are just never going to be possible, particularly if people keep leaving the organization. Every time somebody doesn't renew their membership, that's less and less power that they have because they're a smaller organization with smaller financial resources and et cetera, right? And I think people take that out too. Like they want to think that NATA is this like 60,000 membership organization when in reality, like that's no longer where they at and they don't have that much power, right? So I feel like some of it comes back to education and like being realistic about, because even to me, like again, when I hear people complain about like I want the NATA to have a union for me, I'm like, okay, but like what did you do? Because in reality they're like I want a union. I'm like, okay, again, we go back to this, for what? Like what is your specific request? And then they come with like I need to make more money at my job. And I'm like, okay, that's not a specific, like how much more money? What should that money be for? What should your new title be? And then they have no answers. That's when they go ghost on social media because you've called them out and they don't have any answers. So I'm like, we need to be clear on what the ask is, because I'm pretty sure if we have a very specific ask and then we take that to NATA, they're going to do their best to try to find something. But until we can articulate what exactly we're looking for, then it's pretty hard to get an organization to just make everybody happy, because some of the people that want to be happy don't even know what they want. They're like my daughter. Yeah. My daughter's 3. She cries all the time. I'm like, what do you actually want? And she doesn't know. She just cries because she doesn't actually know what's wrong. She's just frustrated. And I feel like that is I would sum our whole organization up right now as a 3-year-old toddler that is unsure about exactly what they want and they're just whining. So I'm like, when you can articulate, my daughter, I tell her, when you can articulate that all you want is the smokehouse chips from the top of the pantry and you can't reach them, then I will come and I will help you and I will get the stool and I'll reach the chips. But until you can articulate what it is that you want and, you know, and why, then the NATA can't help you. Like they really can't. So I kind of throw that back on everybody as an athletic trainer to really sit with that identity and figure out what is it that you want for yourself and what it is that you want for the profession. And then we can talk about how the NATA could support you or how you could become a part of, whether it's the NATA or any other local or organization, but how you could be a part of kind of helping contribute to solve that. Until you can answer that clearly, I don't see us making any progress.
Yeah. Well, and you have to be willing to let your idea be beaten up a little bit. Because, I mean, the union, I just posted this week about unions, and it's very interesting on the reactions, the strong reactions I'm getting. It's like, but why hasn't it happened yet? If everybody wants a union and that's, you know, the verbal solution to everything that's going wrong with us, why hasn't anybody stepped up to do it? Not yet. I don't think anybody's actually really looked at what it takes to become a union. I don't think our profession is really big enough to support a union. We have 55,000 registered athletic trainers, but I'd say, 70% of that is actually practicing. And, you have to get so many on board to go into a union. And the other problem is we're in so many different settings. How do you adequately encompass those different settings and those employers? And, we keep talking about me, the employee, but they don't understand how expensive it is to have employees these days. Also, I think it's 30% of someone's paycheck is fees just to have you as an employee, with even your benefits, taxes, all that type of stuff. And that's where it's frustrating. Having a business mindset is, how is this all supposed to work out? How am I supposed to keep increasing your hourly rate and charge out these youth tournaments more money, which increases the fees for
Gotta
the
come from
athlete
somewhere.
to participate in, which then affects your personal life because you have kids that are in athletics and those are the fees that you're trying to pay for. So they just don't understand the economics of business
What
and
it takes.
all that
Yeah.
type of stuff.
I always say this. I feel that we all need like one business class and one like history class like every 2 years. Like we do our CPR. I'm like, why don't we just do like this is how the government works. This is how business works. Just, just so we stay refreshed like every 2 years. But you made me think of something to that point, is I know there's a lot of like conversation, if you will, about like specialty groups, right? So I think about like, obviously there's the Performing Arts Society, there's the Physician Practice Society, there's the Industrial. And I know, initially there was some friction there, I guess you will, of people like starting these outside kind of specialty groups. But in reality, like, I don't necessarily think it's a bad thing. I think we obviously all have to meet and be collaborative, but in reality, like one organization is, as we see just in America, right? It's really difficult for one person to represent the views and the ideas and that daily life of people across like an entirely different setting. So I don't necessarily think it's a bad thing that we're seeing some of these specialty organizations pop up and kind of cater, if you will, to a certain subset of the membership. I just think it becomes problematic when we're not able to work together, right? And they start to like silo themselves off. I do think obviously that becomes problematic, but kind of to the whole union thing, I don't necessarily know that it's a bad thing that we're having people come out and represent the individual interest of athletic trainers in a particular stage of their life or a particular setting. It's just, how do we understand that we're all athletic trainers at the end of the day, right? Although our settings or in our patients may be different, or the skill sets that we have are different, our overall passion and purpose remains the same. So how do we support individuality at the same time as supporting, contributions to the collective profession? And I think from a strategic alliance perspective or from an NAT perspective, that's probably one of the bigger challenges that they have over the next, 5 to 10 years for their strategic plan of like, how do we do that well? Like, how do we allow people without getting salty that they like, I don't want to be an NATA member, I want to be an industrial member. Like, okay, but how do we support them in doing that while also they don't lose their identity as an athletic trainer? I think about Alicia the other day. She told me, I don't identify as an athletic trainer. And I was like mind blown by that. Other things that sit with me, like in the middle of the night, this was at our Winter Institute for our DOT, and she said, I never identified as an athletic trainer. And I was like, what do you mean? You've been like, she's like, I don't identify as I did identify as like a nice person. And I was like, oh my God. Like, to our identity, I was like mind blown. So now I think about it like, yeah, how do we do that? Like, how do we identify as something that can transition multiple settings, right? Like, I am an industrial athletic trainer, and that's why I belong to this infinity group, but I also want to belong to the greater good because we all have this similar passion or purpose or identity beyond the people that we serve. So it's a complicated question.
Yeah. So we talked a lot about individual professional identity as the profession's professional identity. How do we as a group come together and forge a better definition? Or, we have the NATA, which provides a lot of resources and guidance, but as we know, not everybody's an NATA member anymore. How do we bridge that umbrella as athletic trainers and their professional identity?
That is so hard. And shout out to the NATA, because they have their work cut out for them trying to figure out how to solve that problem. I feel like somebody may beat me up for saying this, but to some extent, like we do have to belong to the NATA. Again, to my point, like the more people that leave, the less power that they have. And if we are going to expect so much of them, then we do have to give them at minimal, our $300 of support to try to support that. Because at no point do I ever doubt that the NATA is working hard to help athletic training. Like I don't doubt that. Now, does it help me as much as it helps other people? I don't know. But I do know that for me, it is very important to at least contribute that so that I can help. That is the only thing that kind of represents us all. And I feel it a part of my identity to at least contribute at minimum to that, to hope to service other people. So shout out to them because they have their work cut out for them as well. I think, it's hard because I put my research hat on because I'm doing survey now and like nobody will participate. And I'm just like, why can't you just do the survey? Like it takes like 10 minutes and people just are busy or they say they're going to come back to it. And in reality, life just kind of goes on. So I feel like first and foremost, I feel like the only way for us all to get on the same page is to all be together. And whether that's through NATA, through another thing, I think it's just really difficult to help everybody when everybody doesn't participate. And I feel like even in society right now, like we're all just hate each other, right? There's like so much conflict over values and identity and words and language, and all of those things matter. But I think the more that we start to separate ourselves and like create conflict within athletic training, the harder it will be for us to form this like cohesive professional identity. So I don't know how to fix that, but I do think in general, athletic trainers need to get on the same page or at least be cordial and like understand that we are all athletic trainers and we all care about patient care and we all care about a certain set of values and things, regardless of who we're doing it, regardless of how much we're getting paid, regardless of how long we've been doing it. We got to get on the same page to think about like the values that guide our work and what do we want our reputation to be for athletic training in general, right? Like, do we want to be a support staff? Do we not want to be a support staff? But I think just at the most fundamental levels, we need to come together as people and decide, like, when people think about athletic trainers, regardless of if they can define it formally or not, what do you want them to think about, right? Like, oh, those are the people who genuinely care about student athletes, right? Like, I think we just need one kind of mic drop. Like you said, I don't know if we have a universal definition, but we need one mic drop about this is what we want our reputation as athletic trainers to be. This is the impact that we want to have on healthcare as a whole, on business, on sports, whatever we want it to be. But like, we have to get on the same page about the values that guide us, what we want to be known for, and the impact that we have to have. And I think if we can all agree to those things, then we can come together and kind of fix some of the more technical aspects of where we're going and what we want to be called and how we want to represent ourselves. But we have to find a way to work together and get on the same page one way or another. Now, how to do that, I don't know.
Well, and I think NATA has lost a little momentum after COVID with the NATA conference. It brought people together. A lot of different states, organizations, specialties, age range, expertise, whatever you want to call it, everybody in one place. And I don't think they're capitalizing as well as they could be. I mean, obviously the seminars are important, but I think we need to capitalize of having people in the same rooms and doing more breakout communicative scenarios where everybody can actually talk and think together and come out of it having thoughtful reflections. That's where I think the growth comes from. I don't think I need to learn another ACL protocol. I know
use anymore. I always say that they're all like they're free online everywhere. Nobody, I mean, I still always hear about athletes trying to rush and get them right before it's due. But I mean, like there's an excess of access and people go to NATA for the social connection, right? Or for like the networking. And I think that's what we all go to conferences for. Like we may do some learning in the process, but almost all of it, like you said, is to get together with your people, with different types of people, and kind of have that social connection. So I do agree. To my point, it's hard to get people to participate, but I do think the more opportunities that we have to do that, and I will give credit to some of the Strategic Alliance, because I do feel like they've been doing a better job of like putting themselves out there and kind of being in front of the people and being present. So I agree that the social connection is so important. So finding more opportunities for athletic trainers to be in the same rooms and talk through things and kind of have those like think tank, like in-person think tanks of like, how do we think through this with people of different settings? And I think the more we can emphasize how important that is and kind of bring that to people who, because obviously there's athletic trainers that work in silos by themselves or that may work in more rural parts of the country. And I know we don't go out to the West Coast much, but I think the more we can kind of circle around and just bring people back into the social element that they love so much about athletic training and really just hone in onto that identity and purpose, that the better we will be to kind of persist through some of the burnout and the setbacks and the lack of advancement and some of those kind of long-standing problems that we've had within the profession for a long time.
Yeah, exactly. Well, any last parting words while we wrap this up? I know we have so much more to talk about, but I feel like this is a good kind of point.
That's fair. That's fair. I just think that, again, be very clear on who you are and let who you are guide you towards what you want to be when it comes to career advancement. And then just understand that professional identity is never constant. It's dynamic. It's constantly changing. You are constantly growing and kind of going through this QI cycle and this metamorphosis. So who you are today doesn't have to be who you are in the future. And that athletic trainers are social. So at the end of the day, we love people. So don't hesitate to reach out. But yeah.
Well, thank you so much for being on. And if anybody wanted to connect with you, what are the best ways to do that?
I'm on all the socials at Young, YOUNG, professional, PROF_AT on all platforms.
Well, thank you so much for being on, and I'm sure I'll have you on in the near future. We have so many other topics to talk about, obviously, but thank you so much for your insights.
Thanks, Shelby.
That's it for today's episode of To The Bone. I hope we've sparked some new thoughts, challenged your perspectives, or simply reminded you to dig a little deeper. Remember, life isn't just about what's on the surface. Sometimes you've got to cut deeper and get to the bone of what really matters. To The Bone podcast is a product of Daily LLC. It's hosted and produced by Shelby Daly, ATC, and Randy Daly. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. For more on the show, visit www.tothebonepodcast.com. If you enjoyed this episode, be sure to subscribe, rate, and leave a review. Get involved in the conversation. You can find us at www.tothebonepodcast.com. Drop us topic suggestions or be a potential guest. We're all about connecting with you, our listeners. Until next time, stay curious, stay grounded, and keep cutting deep.